What's up, everybody? You are listening to Nursing Uncharted, the podcast that uncovers uncharted territory within your nursing practice. I'm Maggie Reichard. I'm a full-time medical ICU nurse and your host for Nursing Uncharted. Thank you so much for listening today. I hope everybody is having a wonderful Thanksgiving if they're celebrating Thanksgiving. I think this episode is set to air just after Thanksgiving, so I hope you're all eating leftover sandwiches and walking off that Thanksgiving belly. This episode is sponsored by AMN Passport. AMN Passport is a highly rated travel nursing app that helps you find assignments, book assignments, and manage it all from your phone, putting you in the fast track towards your next travel assignment. You receive instant job match notifications when you use the app, so be sure to check it out. So today we are delving into an advanced practice degree. When we think of nursing and advanced practice degrees, we think of NP school, midwifery, CRNA, CNS maybe. But have you ever thought of a master's in public health? I'm sitting down with Dr. K Carney today. She is Associate Dean for Public Health and Health Policy and Professor of Medicine at the Larner College of Medicine at the University of Vermont. Dr. Carney is active in public health practice, research, education, and service. She served as Vermont's Commissioner of Health under 3 governors, championing improvements in children's health insurance, preventing teen smoking, and improving cancer screening. She received the Vermont Public Health Association Public Health Champion Award in 2018 and was recently awarded the UVM President's Distinguished University Citizenship and Service Award for her innovative teaching, creative leadership, and service to the UVM community. So Dr. Carney, welcome to the show.
Oh, thank you. Thank you so much. I'm delighted to be here today.
Yeah, it's been a long time coming. You came up on our radar, a while ago, and we had just finished a season of advanced practice, and nurse educators. And so I was like, I really would love to have her on, but, we wanted to wait till the time was right. So I'm excited to have you today.
Thank you.
So Masters in Public Health. I want to, set this episode up for people that are interested in pursuing this, people that have no idea about what it entails. So can you provide a little bit of an overview about what an MPH program entails and why maybe it's valuable to nurses specifically to obtain the degree?
Sure. Happy to do that. All public health programs that are nationally accredited through the Council on Education for Public Health have to have the same basic configuration and components, and they might have different courses and options and concentrations, but let me give you the general frame. So they might be 42 graduate credits, and some of the areas, they include something, sort of a capstone project and an applied practice experience. So people who are looking at, sometimes we have health professionals either looking for another dimension to their work, as an example, but it's an opportunity to kind of try out something or experiment with a little work with a public health agency or an area nonprofit, something you haven't done before. And so there's that. The traditional areas of public health include the math, epidemiology, and biostatistics. It includes environmental public health. It includes social and behavioral factors in public health. So those are the habits and behaviors. And it also includes, it's either called health policy and management or health services administration. So that's the connection of public health science to healthcare. So those are the kind of the core areas. And if you think about today, and so most programs give you some direct didactics and coursework in each of those areas. But then if you think about sort of some of the more of the issues and the challenges, a lot of those kind of intersect. One of the big ones is right now is the whole challenge to provide high quality information to the public education piece, and prevent misinformation. That might be one. Informatics connects healthcare and public health. So there's a lot of kind of cross-cutting issues also. So I'll stop there, but that's kind of the general frame.
Okay. And so are there different like specializations that you can do within, you know, like do you specialize in social behavior sciences under the umbrella of a master's in public health, or are they all just different courses that are, you know, you take courses in each one?
That's where different programs allow you to do different things. Okay. So what I just described, and we intentionally have a strong generalist program. So we want to make sure that you have depth in all of the foundations of public health. And you still have elective courses, so you can do that. We do have one concentration in global health leadership, and I can tell you more about our thinking about that. But depends on the program. They might say you can have a specialization in epidemiology or in health policy or in the social and behavioral, the health promotion kinds of things. So it kind of depends. The other thing I would say is, particularly people who are already in a health career, there are possibilities to do programs in person and full time, or 100% remote and part-time, or full-time, 100% remote. So we intentionally designed our program to be 100% asynchronous online, meaning everybody's not on Zoom at the same time. The courses are scheduled and using innovative educational technologies such that in any kind of a course, you would have a typical week's work, but you don't necessarily have to be on with your entire class at the exact same time. So what does that do? First of all, that gives people who are working flexibility. Yes. They can complete the programs either, very fast as a full-time endeavor or something that's more of a part-time. It also, in that asynchronous online space, we find we have a tremendous diversity of students in the class, much more than you would actually see in a physical classroom, because we have people who are working in healthcare, working in public health already, and now coming back to get their degree. We have students who are just graduating from undergraduate and going directly in. We have faculty here at our university who are in our program, so the students get a whole mix of very different kinds of individuals in those courses, in our discussions, and so that's the basic. Again, those are just some of the basic differences in some of the programs that you find.
Gotcha. And I think something to point out too, in very broad, for our listener bases, it's not a classroom full of nurses. This is a large encompassing, variety of different backgrounds coming in. So, having a master's in public health, it's very important for nurses to have these types of degrees. But yeah, you'll have like a vast majority of how many, is there a majority of people in like one specific type of healthcare getting public health? Like what's the percentage of courses being nurses?
Well, nationally I can't answer that, and I can speak, but I can tell you that we have a mix of different kinds of people. So people who are working in public health or not-for-profit organizations might not yet have had the opportunity to have that formal graduate level education in public health. And not really that Master of Public Health, as I said, because of the national accreditation requirements, that is the most common public health degree. And also you can be certain that graduates from an accredited program have some specialized skills in those different areas. And so we have, for example, a real mix of people who are working in nursing, mental health, healthcare across the board, different healthcare professions, including medicine. We have people who are in government agencies who are getting their full credential. We have undergraduate students who may or may not have different majors undergraduate, and then have decided that they want to try that career trajectory either by itself or sometimes some of them go on to do a healthcare credential as well. So really, it varies quite a bit. And some of that, it might be helpful to understand a little bit about what are some of those unique educational components. What kinds of, how does that help? If you're a nurse, as an example, people have probably heard about public health nurses, and that's clearly an avenue that people can choose. But the way healthcare is evolving, there's other opportunities with those skills. And also, well, it's no surprise to any of us that just coming out of the pandemic, there's so many public health needs at so many different levels that people who are trained in healthcare can help meet those needs.
I kind of want to unpack that a little bit more. I mean, what type of jobs do you see nurses with public health degrees normally, taking on?
So let's maybe start with the something that's familiar, which is the public health nurse. So what does a public health nurse do? So somewhere in nursing education, you might make a decision to be a public health nurse. And let's say that you might work for a state, county, or local health department. Every state has these. Here in Vermont, we have a state health department with district offices with public health nurses who work in them all over the entire state. And they might have a unique role in immunizations, infectious disease outbreaks, connecting and meeting the needs of their community. It might be health education. It might be environmental challenges, all kinds of things. Okay. So that's something, so nurses working within the public, what we call the public health system, that's certainly an option. Within, maybe in healthcare, so unbundle some of that curriculum a little bit. So the math, the epidemiology, and the biostatistics, those are requirements of all graduate public health programs. How does that help a nurse in your career? So think about, there's a couple logical paths. Think about population health. Most health systems were less a collection of hospitals and individual healthcare practices these days than more collections of hospitals and practices and clinics and health systems, right? So we think about population health, because we have electronic health records, you can now look at all of the patients who are in that health system and learn characteristics about them that help you to deliver the highest quality of care, to identify gaps in care, to identify opportunities for prevention, all right? And a public health mindset, which you get from that education, is public health is about preventing disease whenever we can, and meeting the needs of entire populations. So you start to think about those individual patients as a group and think about, well, are we making flu shots available to the patients that we serve? Are there other services that we find that people need? And it's that kinds of thinking in population health management. That's clearly an extension of the skills that you might learn in a public health program.
Sure. Yeah, that makes a lot of sense. And I think that would be attractive to nurses who maybe work at the bedside and they see these patients come in that don't have a lot of resources, that, you wish that they, something was preventable. And there's such a, mindset shift in the hospital where we're truly there to fix a problem, not, thinking about like prevention, or what could have happened to prevent this from happening. And so I think, the opportunity to kind of step back and look at maybe an overview of what's going on in the community, I could see how that could be attractive to nurses need a little bit of like change of mindset, you know.
It gives you the ability to, as you said, you can step back and you can sort of see the big picture. At the same time, you're looking at the needs of that individual patient. Some of the other areas, you know, the social and behavioral factors. So think about the risk factors for your critical care nurse. So think about someone with serious cardiovascular disease, right? Who might have a long-term smoking history, right? So you think about community-based strategies and the science of preventing illness in entire communities. And that's one of the things you learn is how can we take advantage of every opportunity to prevent the consequences from some of the habits and behaviors that might be addictions, like tobacco or opioid addiction is a huge issue in many areas of the country. Whether or not we get enough physical activity or we're sedentary, and the quality of what we're able to eat, those have a huge impact on people's health. And those social factors or social determinants of health, if someone depends on do they have a job that pays them a livable wage? Do they have transportation to get regular health care? Do they have a house to live in? All those things. And nurses and health professionals and public health professionals who understand how all the interplay of these different factors impact people's health can be so incredibly helpful in making people's lives better.
Yeah, absolutely. I could definitely see that, because you see the cracks of, you know, you can assess what the needs are of these patients that, you know, these chronic of patients coming in for the same thing. And, you know, I'm sure it would be so meaningful to be able to, you know, decrease the rate of like ER admissions, you know, coming in for like things that could have been, you know, dealt with if they had the resources at home, or the education set up, or the, you know, outpatient supplies in place.
Yeah, exactly. And the other couple of areas, so I just might mention briefly. So the other one is health policy management, or health services administration, and we call it health policy, leadership, and advocacy. So that's understanding how our health system in the U.S. really works. And as a result of that, what are our opportunities to be leaders within that? And I would say that clearly within health systems, there are currently and will continue to be increasing roles for leadership. And so part of that education is around the leadership parts of our system. Sure. And then the final big area is in environmental and public health. And of course, the biggest challenge there right now is climate change and all the health conditions that are impacting so many people. In our area, you know, over this summer, we had massive flooding. In some areas of the country, it's been just horrendous heat waves. And so think about the breadth of that. So that's sort of the breadth of that kind of education and perspective, that if you are someone who is skilled and equipped to deliver health care to individual patients, it gives you just a different perspective and a broad perspective and a context to help those people.
Yeah. And so all of these things kind of encompass something that a public health nurse would do if you're, you know, applying for that type of position. Are there other types of positions, like, you know, you talked about informatics, maybe, you know, nurse informaticist, you know, that also public health degree could you know, benefit if you wanted to take a position there. Are there other, like, you know, job titles that you find, you know, people take on because of their master's in public health degree?
Yes. And I think that depends on stay within the health system. So if most health professionals are working within a health system usually, right?
Yeah.
So you might be the leader, certainly the panel manager of a large group of practice. You could be in a leadership role within the entire organization, in either inpatient or outpatient or a subset of healthcare, but it prepares you for a larger role within that health system.
Yeah, I see. Okay. That makes a lot of sense. Yeah, I could see how, it really, you have such a large subset of skills after getting this degree. It seems like you'd be well equipped to assuming a leadership position in your field, not necessarily, specifically in public health, but you need that bird's eye view, that overview of how the systemic hospital practices work. So that makes sense to me. Can you tell me what are the typical admissions requirements for Masters in Public Health programs specifically for your program, I guess?
Yeah. The graduate program, so you need to have an undergraduate degree. Mm-hmm. And we don't ask for GREs, and feel that they have been exclude people and based on historical practices. And so we don't have a specific cutoff for a GPA. For our undergraduate students, we require a 3.0, and we require one course in math and one course in science in college. And so you don't need statistics to learn statistics, but it's really helpful to have math fluency and just be familiar with science. And then the coursework, we teach you all the different public health sciences that you need for your degree. So that's it. So there's no specific major, and we have our students come from, some of them come from a program in public health sciences from our College of Nursing and Health Sciences, and they come into our accelerated MPH. And some of them come from our College of Arts and Sciences and from a global health minor or a health and society major or anthropology, but they come from all over. And then the requirement is that you have a math and science course, and you have we like to see you have a passion or at least some idea of what you would like to do with your degree. So we ask all students for a personal statement as to why they want to study public health.
Yeah, I think that makes total sense to me. Do you find, strong candidates, students have like a specific set of skills or specific characteristics, overall? When I was sort of describing the kind of the 5 areas of public health, they're very broad. They include everything from the math to the behavioral sciences and health policy. Yeah. And so what I really like is I like the breadth of students, and they come from their own perspective. And what I look for when I'm reading their applications is what is it? What is it they're passionate about? And sometimes it's a personal story. It's a family member who was quite ill, and there was something in the community, and there's something there. Or people envision themselves working in an occupation, healthcare, a community, a government public health agency. Sometimes it's a global, and they want to work in global health. And what motivates them? And that's the thing, that if they bring that passion and their own personal passion, what they think in advance they might want to do, that those students are wildly successful. Oh, okay. Yeah, you were talking about global health and how University of Vermont has like a specialty, right?
Yeah.
Of global health. that seems like such a daunting task to me. How do nurses fit? What is your role in, thinking about global health, and like, how do we help? How does one person help in that topic?
Well, global health, as you said, is so incredibly broad. So here's what we decided, and it's a concentration, and students can elect that concentration when they come into the MPH program, and they say, I want to participate in the concentration in global health leadership. So we give a course in global health, a course, and they have to take a course on climate change, and we have a couple different choices for them. And one is climate change emergencies, and that's something that is, as we know, has been a huge issue anywhere in the world. And then a specific course on global health leadership. And what does that mean? Well, when we looked at some of the, our students have been, over the past maybe handful of years, been very interested in this in our faculty. And people have brought different interests and experience. But when we looked a little more closely at this, one of the big gaps out there in people wanting to be involved in global health. And this could be going somewhere, okay, providing direct services, or in charge of a local organization that provides services. It could be working with an NGO here. It could be a government organization in the U.S. that's involved in global health. There's a lot of different options. But the gap was not necessarily in the people going and doing the work direct here on the ground. It was the people who had the skills to manage the entire program, the leadership part. So that's what we decided to offer, that curriculum. So, for example, a nurse getting involved and concentrating in global health leadership would have the skills to be the supervisor of the program, to ensure that whatever care or health services were delivered, they'd be delivered when you weren't there. And those programs could be sustained. So lots of different choices. It's a very large space, but there seemed to be a real need for people who have the leadership skills and management skills. So that those include things like you have to know how to have a budget, right? To manage people, and people have, and different personalities, and how to be a good representative of your organization in a culturally sensitive way. So those are the kinds of skills that we're trying to provide students in our program. Okay.
And I'm sure that would probably give people an opportunity to work for, like we're talking about national organizations like or World Health Organization, or, Center for Disease Control, maybe, or I'm trying to think of some of these
Red Cross. Think about like the Red Cross as an example, right? Think about there's global organizations. So there's a variety of different choices for, and there's clearly a need for people with those skills.
Sure. I want to talk a little bit about research, because I'm sure, in nurse policy, it's a, big topic in the hospital, also evidence-based practice. We're always moving towards doing the most up-to-date for quality patient care. How does research, play a role in the program?
Agree?
Yeah, we'll start there.
At the master's level, some of the courses that we mentioned, the epidemiology and the biostatistics, those are skills that you use in research every day. Yeah. And, I do that in my work, and those are sort of some of the foundation skills that you might use. Some of our graduates, you're prepared at the master's level. Some of our graduates are working in research settings, and that's an opportunity. The quality improvement side of healthcare clearly lends itself to this kind of thinking. Okay. I would also say that within the program, you have an opportunity to you do a group as part of our capstone culminating project, we call it. It's a group of about 5 students, and you learn to use a very large research database. And actually, we do everything in teams now, right? We deliver healthcare in teams, we do research in teams. So you work with your team of students and a faculty, and it has you have a mentor, and you have a couple of course faculty as well. And you develop your research question, you figure out how to work with your data and interpret that, and write a manuscript and create a poster. And it's really kind of simulates how we do research in the real world. And students do go on. Some students go on and publish or present those projects. So you can get some training in that.
Off the top of your head, is there any kind of like exciting research that came through, your program or at UVM?
Let's see, one of the ones I was involved in, let's see, yes. I'm trying to remember the current projects that we had 2 students presenting their posters at American Public Health Association this year. And I can't remember all the particulars of their questions. The one I was involved in several years ago, we actually looked at public health data on death certificates and whether that was accurate, since people use that to determine funding and health priorities in entire states in our country. So it varies widely. We sometimes look at some of these groups studied opioid addiction and reporting, and looked at the statewide data around elements of that as it connected to the health system. But there's a variety. We have about at least 8 to 10 projects every year.
Okay. Are there, popular topics right now for research, or like hot button, noteworthy research that you're seeing in the public health realm right now?
What we pretty much do is we have students who might be interested in different aspects of public health. So it's sort of driven by the national database. So you might use the behavioral risk factor surveillance system that gets at those habits and behaviors. That's a big CDC survey. And there's an analogous one for adolescent health. So if you want to look at aspects of adolescent health, for example, a team might look at some of those questions. So it varies year by year. And we also have some healthcare-related databases that they do. We have a hospital discharge data set here. And let's see. Yeah, there's a whole list of them. So it varies. And it's a bit flexible because the faculty want to allow the student group to determine what topic they might be passionate about for one study for their project.
Sure, yeah. I think learning, research is such a passion of mine, because I think we had talked just a little bit about misinformation and how it just spreads so quickly. And I really wish that, I think understanding research is, you dabble a little bit in undergrad, but for the most part, you have to get an advanced degree in order to really delve into like how to look at studies and to determine like what is a good study. And so I think that's such an important piece and relevant piece of public health right now is equipping people with good studies and being able to understand them and being able to educate people on what is a good study or not.
We have in the faculty, and how we do this, and one of the areas that we are currently trying to expand is involving our MPH students in our own faculty research. And as an example, you mentioned some of the hot topics. Some of the hot topics here involve addressing the needs of our rural communities and trying to, there's a lot of health disparities, access to care, Climate and health is a big one. I mentioned some of the floods. Access to high quality health information. So we work in some of these grants, and different faculty are working on different research projects to try and involve students in our program the opportunity to be involved in some of our work as they progress through the program. And another thing that I'm trying to launch in the next few months or so is to give some of our students a very small internship opportunity around health communication, because that communicating scientific information to the public, it's really hard. You read research studies, and then you say, oh, let's see, how should I explain this? And you have to explain it so it's understandable and credible, and people actually might want to follow that advice, right? So it's very hard. So I'm trying to put together an experience for our students to be able to practice that, either through their, take something that's current, and many of these topics are quite controversial, right?
Yeah.
And be able to explain it to people. And that could be, it could be a short written something, it could be an audio or video, but get some practice doing that, because in terms of, that's a huge needed skill set.
Yes.
For people in healthcare and public health, right?
Yeah. Absolutely. That's great that you're doing that, because it's such a area of improvement in the hospital, certainly. Taking this complicated picture and breaking it down into layman's terms so that your patient understands it, that's something that is so needed. And, I wish that there was opportunities for, courses like improving communication like that with your patients. So that's wonderful that you're trialing that in your program. What advice do you have for nurses or healthcare professionals that are maybe considering pursuing an MPH degree? Do you have any, prospective nurses that might be considering doing an MPH program?
I think my advice to people is to think about, in your day-to-day work, what's really bugging you? What is it? Is it that the system there's something in the system you could make better in terms of the quality of the care you're delivering? Is there something that you see, and say maybe you've seen in several patients that you're taking care of, that you feel like somebody needs to make that better? And it could be like transportation to healthcare so that somebody doesn't end up in the emergency room. It could be access to better food. It could be, I would say, think about the things that you see that you feel like need to be changed, and that you want to change. And if there's any of those that you could see yourself getting more involved in being that change, that's what you can do in public health.
Okay. Yeah, and just thinking about that, these are such large systems. If you work for the state, then you could spend all of your time working, and never see like the hospital system. Is there, I don't know if I'm explaining this question correctly, but is there places where those two worlds intersect? Is there does a public health that work for the state, do they ever, have experience going to the hospital and seeing how those hospital systems work?
Yes. And those places where they intersect, and that's where I live, that's kind of the world I live in. And so my background's in medicine and healthcare, and then I studied public health and been very involved in public health practice and research, most of my career. And so here we have close collaborations with our State Department of Health, and we do research together. And we have we work together. We have our students from here work with them there, and a back and forth. And I would say that's absolutely possible.
Yeah. Okay. Well, there's been such a great conversation, and thank you so much for coming on and talking about this with me today. And I think I see the value in nurses being a part of these institutions, and I think it's instrumental towards understanding of the workflows and to improve people's lives. It's so important for nurses to be a part of these roles.
I totally agree.
Well, where can people find you, or is there any, if they want to apply to your program, where can they apply?
You can find UVM NPH program on the University of Vermont website, and you can start there, and there's a place where you can chat with someone and ask questions, and you can go there. They can write to me directly, and if they're interested in public health, we're here to do our best to answer those questions.
Great. Well, Dr. Carney, thank you so much for coming on today, and we will talk to you soon.
Thank you.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubin and Sam McKay, and Aidan Dykes for the music and editing. Until next time, take care of yourself.